So I guess the point of this video is Christine and I are getting together to talk about the core and talk about the core from a Pilates perspective and a physical therapy perspective, because there's a lot of overlap and they really work well together. So both of us being circus nuts and aerialists and really into fitness, the quarantine has been harder on us, I think, than the average sedentary American. And it's probably been harder on you guys because there's so many things we want to do and we can't do them. So we decided we would just meet up on a Saturday during our free time and talk more about anatomy and physiology to pass the boredom. So we're gonna share these videos and segments with you guys. So hopefully this will answer some questions and get you thinking critically while you're stuck on your couch.
Yeah, sounds good, because the opportunity right now to dive into the details when we are not able to do our training in another way just adds a whole new aspect to it. So I'm excited for this.
Yeah, me too. It's concerning how unfun I sound on paper, because this is really interesting for a Saturday, but it's okay. If everyone's watching this, you're just as nerdy as us. So no judgment here, no judgment. For those of you who don't know me, my name is Angie, and Angie Prescott, and I'm a physical therapist by trade. I've been in PT for, wow, I guess 16 years now. So that makes me feel exceptionally old. My background is in an osteopathic orthopedic manual physical therapy training. And I love the hands-on part of PT. But before that, I was a gymnast, a circus performer, and a big fan of movement and fitness. So my practice, Acro PT, is basically built around those two ideas: manual therapy and hands-on care, movement analysis from a circus, gymnastics, and acrobatic background. So that's my sort of summary life in a nutshell here.
And I'm Christine Heckel. I'm a Pilates instructor trained in the STOTT Pilates method, which is a contemporary form of Pilates. I am also an instructor trainer for Merrithew, the parent company of STOTT Pilates. And so I spend very often weekend time doing certifications, training new instructors. I've been teaching Pilates for about 10 years at this point. And I came upon it at a point where I was moving from my background as a student of classical dance for about 15 years at that point into a teaching role, and found that Pilates gave me a lot of information about the body that none of my dance teachers had ever described things in that particular way. In particular, what to use, what not to use, how my body worked. And I was absolutely fascinated and felt this is what I need to teach my dance students, and went down the Pilates certification path, moved through my own journey into the path of aerials and circus arts, and found that a lot of it translated very well to what I was learning as an aerialist, except for I got to come in at the beginning before I had trained a lot of things for 15 years straight a different way, and think about them through the lens of how am I doing this movement? What do I use? What do I need to back this up? And so it's been something that's helped to keep me healthy and moving, and think about how I do the types of more extreme movement that I love.
Awesome. Yeah, no, I mean, thinking back to all the years of being a competitive gymnast, I started when I was 8 and competed all the way through 18 and had a phenomenally crappy background in movement and core engagement and coaching. And so by 23, I'd broken 23 bones, which at the time seemed like a pretty cool number. Sitting here at 37, it feels like that was just not right, because I haven't, knock on wood, broken any since. And a lot of that is due to basically poor training and poor coaching and poor sort of assessment of movement. I had a lot of gymnastics coaches that sound similar to your dance instructors, which was, you know, this is the way it's always been done, so we're going to do it that way. And I was never a flexible gymnast. I had terrible back mobility. I was phenomenally strong in all the wrong places, and I was intensely competitive and stubborn. So that was just a horrible mix. So getting into working with circus and gymnastics was, for me, more about training the Gymkhana team after I left the program, because I was on the team in college at the University of Maryland, and I became one of their sort of physical therapists and trainers when I was working initially in PT, and realized that they were all basically succumbing to the same horrible injuries I was or had been at the time, because nobody had identified that. So if I could go back and talk to my 14-year-old self about core engagement, I'd love to. She was really stubborn. She probably would not have listened. So it'd be a waste of a time traveling trip, but maybe somebody watching this video is not as stubborn as 14-year-old Angie, and they'll take this information, scale back their training since they can't get on the fabric anyway right now, and fix things. So.
Yeah, and I can definitely relate to that because I came into dance just passionately wanting to learn it, and my dance instructors would show a movement and ask me to repeat that. A lot of like what we do in aerials, we're working to form our bodies into the same shape without a talk about how it should feel and what I was using to do that. And when I first encountered Pilates and had an instructor who said, no, you are using your hip flexors to do everything. That is not your core. And I said, well, I'm really strong. What do you mean that's not my core? And she kept backing it down to the level to where I actually discovered my core, and then things started to change. That mysterious phrase that my dance instructors used, use your center to turn, to really bring your body into one piece and connect it, became something that I started to understand. And then the realization that I am hypermobile in quite a bit of my body, which was something that no dance instructor had ever let me know, because I always thought I wasn't flexible enough. And so coming to it from the, how do I put all these pieces together to make them work for me, was really enlightening from the hypermobile side of things.
Yeah, that's actually, I mean, that's really common. You see people that have areas of hyper and hypomobility, and they assume that they're inflexible when they're actually too flexible in some other places. And that's a big PT problem I treat. But yeah, I think I first identified that I misunderstood my core when I was studying in PT school, getting my doctorate. We had to do an abdominal muscle test where you lay flat on the ground and you basically sit yourself up without your feet leaving the ground, without any rocking motion. And, you know, here I am doing, you know, double backs on trampoline and all kinds of crazy flipping motions. And I can hold a plank for like, you know, 8 minutes, you know, while eating a slice of pizza. And I think I'm just, you know, the bomb. And I get like a 3 out of 5 on this test. And the girl next to me, who's a dancer, a Pilates instructor, and has spent a couple years as a yogi, gets a 5 out of 5. And I was beyond infuriated because, you know, 23-year-old Angie was almost as bad as 14-year-old Angie. But that was my first introduction to time out. You're not as strong as you think you are. And you've been doing it wrong all along. So hopefully somebody watching this video will have that sort of epiphany moment where they've done something and they felt inadequate. And hopefully they're going to recognize that it's nothing they're doing wrong. It's just nobody has taken the time to sort of give them the right cues. They haven't had the chance to work with a Pilates instructor like you or gone to a PT that's going to help them identify that that chronic hip flexor tightness that you keep releasing isn't going anywhere no matter how much you peanut it. It's time to change things. So yeah, that's kind of our background. So if you're in any way similar to Christine and I, and you've been there and done that, then stay with us for the next couple parts of this video here. We're going to move on and talk about some topics that we feel will lead you down the right path. So.